Good afternoon. It's a pleasure to be here. It's an interesting situation for me to stand here, not being an expert on benefits or even currently on the welfare system in New Zealand. By background, I'm a strategist, and I've done it in a range of different areas. But my first job was with the Department of Social Welfare. And I was a researcher there for nearly 4 years. Its name's changed, but I think the scope is reasonably similar to what it was then. So the foundations of my training is in social science and in social science research, but I've been in business and strategy and economics, and also in organisation. And so I'll be bringing a range of different perspectives to the topic today. And the material that I'm going to share with you is actually some material that was put together as part of a program for the New Zealand Institute. Our scope covers economic, social and environmental issues, and our purpose is to improve long-term outcomes for New Zealand and for New Zealanders. So we do not represent any particular interest group, but rather the future of New Zealanders as a whole. And our purpose is really to try and improve outcomes. So that's the perspective that I bring today. And what we did was to start looking from the outside in, and starting with social issues, and then thinking about welfare and benefits being within the context of welfare. So it's that outside in approach that I'll be talking about today, not about the benefit system itself. What we found when we started to look at this and using a sort of a strategic and an organisational and an economic lens was a range of things that didn't seem to be working as well as they might. So what I'm going to share with you is some of the material as we try to bring that together into a coherent story, and this is just part of the story, and it's what we've shared with our members. So let me start off with social issues. Social issues arise for a variety of reasons, but essentially the common feature is that societies intervene in order to address those. And it's generally when the outcomes as a result of events or circumstances harm people or impose costs on the society. And society then makes a choice. It's going to help or influence or coerce the individual to make different choices. It may provide income, housing, health or other supplements to sustain life and reduce risk factors, which is where the benefits and part of it fits in. It may provide education to influence values and beliefs so that the individual makes different choices. It may provide social supports and legal constraints, or it may even lock the person up in order to prevent unacceptable behaviour. So in a way it's about the society intervening to get the outcomes that it's looking for, and it may intervene on behalf of the individual who's being influenced in that process. And if you step back from that and say, well, what sort of questions do you ask about how you manage a system like that? And it seems that there are three things that you want to try and do. You want to reduce the harm to the individual, you want to reduce the costs in general to the society, and as we all know, the costs are substantial. And you want to improve productivity, because with that economic lens, it's obviously better to have people contributing in the broadest possible sense to the society that they're working in. And the challenge for us as managers of such a system is to think about what are the investments that need to be made. And I think the framework that should be adopted is an investment framework rather than a cost minimisation framework. So when we had an initial look at this, and it was about 6 months ago, it seemed like there were a lot of things that seemed to be wrong. And I'll just go through those. The first one was low aspirations. It seems that there's a kind of, well, what I saw was an acceptance of it is the way that it is and it's going to stay that way. Also very large costs, mostly for consequences and for benefits, not a lot on prevention. And when you looked at the measurement system, what you saw was a cost and operational performance focus. You saw the challenge of NGOs and clients becoming dependent, in a way institutionalised, and a lot of issues where outcomes aren't being improved. And if you then look at New Zealand's performance against some other countries, many issues where New Zealand isn't doing very well comparatively. And that, I think, is a set of, you may agree or disagree with that list, but I think that's a list of symptoms. It's not a list of causes. If you try and then dig below what the causes of that set of symptoms might be, you come up with another list. We talked with a range of people and they all talked a different language, doesn't seem to be a unifying framework or theory that underlies the way that we approach these questions. And I caught the last part of the last session, and I think it was pretty clear from the dialogue then that people were really saying, you know, where's the unifying framework? An emphasis on response, not on prevention. I think weak outcome-driven performance management, not a strong connection between the outcome and what we do next. Some institutional inertia, and certainly specialists operating within limited paradigms, and a provider-centric rather than a client-centric approach. And I know there's been some positive changes in that direction. So look, this may be a little superficial, but it's an outsider's perspective in a way, but in a way also a kind of informed outsider. So the question that led to then was, you know, do we really have the right paradigms? How do we look at these issues? And often we look at these issues through the supply system. You know, is it a health issue? Is it a school issue? Is it a prison system? These are the provider paradigms, and they're often individually focused rather than community focused. Or we may look at it in terms of a life stage: children, teenage issues, the school to work transition, or retirement. What we do know is that there's quite a lot of concentration in particular communities. And, you know, one of the questions we could be asking is, who are the people, who are the families, the households and communities that have multiple interactions with social agencies? Why do they make the choices that they actually make? And what are the economic and human outcomes that would result from different strategies? This is a bit of data that came out of some work that we did for a project called New Zealand Ahead, which was looking at 16 societal performance indicators for New Zealand. And what we see is that New Zealand scores really well. These are 15-year-olds on the left-hand side of this chart. 15-year-olds, we're fourth in educational performance for 15-year-olds in the OECD. By the time we get to completion rates for upper secondary education, we're 20th. And by the time we get to unemployment for 15 to 19-year-olds, we're 24th out of 25th. So something's going wrong in that system. And when you ask yourself what's going wrong in that system, you ask yourself how it's being managed. How is the transition from school to university being managed? How is the transition from university to the workforce being managed? And I won't go into all the things that are wrong there, just simply to point out that this is one illustration of the way in which we have siloed approach to the problems that we have, and we're not getting very good outcomes because of those siloed approaches. We need more integrated approaches. So the way I would propose to approach this problem is to look at it at four layers. The first layer is what are the choices that individuals make, and how do they make those choices? Let's look at it from the individual's point of view. Let's not look at it from our point of view. What do they do, and what happens to them as a result? I think that's a pretty common one. That's the level at which statistics are generally collected. What are the economic consequences of that individual behaviour and of the societal responses? And what are the institutional responses to the social issues, and what outcomes are observed? Because I think unless you look at all of those things as part of the package, you're going to get too narrow an approach to get really powerful solutions for the longer term. And if you think about this from a long-term perspective, what would you like to see happening? I guess my personal view would be the list that's on here. To move from a lack of concern about consequences for others, it's all about me, to everyone actually caring about outcomes for others. So it says it's not just about money, and it's not just about welfare, and it's not just about intervention, but it's about the culture that we live in. People being shut out from opportunities, to worthwhile opportunities available for people, whatever their circumstances are. People who are isolated from a community or embedded in an unhelpful community. I was talking with someone yesterday who said they had a fantastic program. It dealt with people's issues. I won't go into the particular issue, but it dealt with people's issues, and they were, you know, in a sense, their issues were resolved, and then they went straight back into the community that led to the problem in the first place, and straight back to square one. So everyone connected to a positive community context. And then there are lots of gaps in support or help when skills and guidance and constraints are required, and a place where appropriate support and help is available when appropriate. This may seem perhaps idealistic and vague, but I think if you're thinking about designing something for your long-term future, you need to have some kind of vision of what that future looks like. Thank you.